Good evening, you guys. It's Dr. Christie Hafer here with another one of my connected interview series. I've got Katie Packwood with me today, and I know I've been talking about all these interview series and telling you how much I want to share information that I know from practitioners that I know with you, because these are people that I refer patients to. These are people that are in the community helping patients that have a super just big heart and a passion to help people. So I had asked Katie Packwood because she does some fascinating work with the brain. With the neurofeedback. And there's some people that are really familiar with neurofeedback, and there's lots of people when I talk about it, they have no idea what I'm talking about at all. So she also has a history with doing functional nutrition and French. She knows French. I mean, I learned all sorts of new things about her today. So Katie, explain a little bit how neurofeedback works.
Okay. So neurofeedback is a way to use a computer to monitor brain waves in real time. With EEG equipment. So we have sensors stuck on the scalp and we're monitoring the brain waves, and then we're essentially reflecting that information back to the person. And when a brain can see itself in action, it can learn from itself and learn how to adjust its own functions. So it's a way to utilize technology to monitor brain waves in real time, give that information back to the person, and then the person's brain is like, oh, I didn't realize I was doing such bad things. Or so we can inhibit something that the brain's doing that's not something we want and encourage it to do something more of something that we want it to do. So a good example is ADD. And actually this is one thing that the American Academy of Pediatrics in 2012 recognized neurofeedback as a level 1 intervention on par with medication.
That's cool.
So
wow.
But it's not medication. So it's
Natural.
better because it's a way for the brain to actually learn how to fix itself and learn how to better self-regulate. So in a lot of cases with ADD, what we see is there's excessive slow wave activity, usually in the front part of the head. It can be in the front, it can be in the temporal lobes. But when there's too much slow wave activity, like delta and theta, those are more of like sleep and daydream states. Okay. And then there's not enough beta, which is your focus and attention wave. So it's really about this, it's an imbalance. You've got too much delta theta, not enough beta. We want to help the brain get those into a better balance. Bring the power down of the delta and theta, bring the power up of the beta.
It's like a balance that you're trying to create.
Yeah, we're trying to create a better balance and better rhythm, because also things that happen when people have problems, symptoms like anxiety or depression or OCD, tics, even physical tics, those are all just symptoms of the brain's not well regulated. Yeah. That the rhythm of the brain, there's part of the brain that's running too slow, there's a part that's running too fast, so the timing gets off. And when your timing isn't optimal, your function's not optimal. Right. So really, you can think of neurofeedback as really intensive guided brain exercise, but we're using specific protocols based on the person's individual brain.
Yeah, very individualized, because
it's extremely individualized.
We work with together with it. We have several patients, and she sends me a brain map of somebody and all of where they're off and what's going on. I of course don't know how to read it, but it's really cool to watch the progress and the changes that they have. You know, from we've got patients with anxiety that we see together, ADHD, some epilepsy, and depression. So tell them more about what you see, what does a session look like, and
kind of what the process is. So the first thing I like to do is start with a brain map, and this is an EEG of the brain. So we are putting a cap on the head, and believe it or not, kids are great. I have never had to restart an EEG on a kid. I have before on adults. I'm hold still. I just tell the kids, if you wiggle, we have to start over, and then it's going to take longer. And I've had kids be really great during this process. So we put the cap on the head, we squirt gel in there so that we can basically pick up the electricity that the brain's creating and record it. So we do a recording with them with their eyes closed. That's our baseline. And then I have them open their eyes, and we do another recording. So we want to see the change between a brain at rest and then an engaged brain, when your eyes are open and you're, at school, you got your eyes open, so that's probably how you are.
What kind of information are you taking in?
Exactly, and then we're looking for that change between the eyes closed and the eyes open, what's changing there. And once I have that information, I know what their pattern is, I know what part of their brain is, most out of normal range, and we're going to target that area of the brain and give it the information so that it can figure out how to adjust itself. So, like back to that example of ADD, too much slow wave is typically what's happening, and we want the brain to learn how to lower the power of the slow wave down more. And so what we do is we're basically inhibiting certain frequency bands where we set, they're interfaced with a protocol that's going to inhibit something we want to come down, and we want to encourage something that's too low. So basically, the cool thing about the way my system works that I use is the kids watch movies. So they get to put on Netflix or DVD. So super high compliance. This is really easy for kids. I put the sensors on their head, which area we're going to target. We plug them into the computer. They sit in a chair. They get their headphones on. I also use photic glasses, which they're set at certain rhythms, which are also giving information to the brain about like kind of what beat to go at.
So cool.
And and the kids are watching a movie, but there's a filter over the movie, and the sensors on their head are driving the filter. So their brain is literally controlling the movie and making the movie fade in and out. And kids don't even have to understand how this is working. This is the great thing. Their brain figures it out.
Yeah.
Their conscious mind is being really entertained by the show. That's the whole purpose of the show. The show has nothing to do with how we're training the brain. It's just to keep them occupied for half an hour and entertained. Their conscious mind is watching the movie, but their unconscious brain starts to figure out that it's controlling the movie. And then it starts to go along with the protocol. Like if, we're saying in the protocol, let's lower 2 to 7 hertz because that's the part that's too high.
Yeah.
So every time their brain kind of shoots up the 2 to 7 hertz, it's like the computer goes, stop, stop.
Yeah.
And it blinks out, and their brain starts to figure out like, oh, I'm doing that.
Right.
I'm doing that. And that's me. And then it starts to lower the power because it's using operant conditioning. So operant conditioning is just rewarding what you want and inhibiting what you don't want.
This is cool.
And that's the brain. That's a basic way we learn things is through getting rewarded for what we good things, and we get punished for bad things. We learn not to do the bad things and do more of the good things.
That's amazing.
Yeah. So it's actually a pretty simple concept. It seems complicated because we're dealing with the brain and there's lots of equipment and technology.
Right.
But the concept is actually quite simple about how it's working.
That is so crazy. I love it. I love it because we talk about the brain all the time in our office, and in a lot of our videos we're saying that we know that the only thing that changes in the brain when you deliver a chiropractic adjustment, or the only thing that does change, is in the brain, prefrontal cortex. And it's changing the way the body's communicating with the brain. We know that the brain can learn, which is awesome because we used to think what you got is what you got, and that's what you have to deal with.
Brains are learning machines. That's what brains do, is they learn. And they've learned everything they know from themselves, right? From their interaction with the environment. So something like neurofeedback, the reason it's such a powerful intervention because it's giving the brain real-time information about what it's doing. And the brain's never had this before. So when you hook a brain up to a computer and you start giving it real-time feedback, it's like, oh, wow, that is me. It's like giving your brain a mirror.
Yeah.
Well, it's kind of like, a concept or a analogy I use is like, if you've never seen the back of your head ever, and somebody gave you a mirror and you looked back there for the first time and you realized you had like a huge snarl of hair back there, you'd be like, oh my gosh, I should comb that out. So it's kind of that same concept. You're giving your brain basically a mirror to witness its own function.
That is so cool.
And when it can witness itself and it's tied into a protocol that's basically, using operant conditioning to reward stuff we want more of and to inhibit something we want less of, the brain will adjust itself. And because when the brain learns something, it knows it. So this can be a permanent, you can have a permanent shift in your function with neurofeedback.
Which is awesome, which is a lot of what you've shared with me and patients that you've seen, that, they'll come back in when they hit their next level of stress, like we talked about.
Yeah, life still happens. So, I work with kids. I would say probably about a third, sometimes a half of my clients are kids and teens who are struggling with school, struggling with ADD, OCD, autism spectrum, behavioral issues. Those are all brain-based problems.
Yeah.
The brain is acting up, and so we want to help the brain to get its timing and its functional synced up. And when you do that, the problems just tend to lower in intensity and frequency. It's not like, when you take a drug and you immediately feel it.
Yep.
Okay, neurofeedback's not like that. It's a process because it's a teaching process. So we're teaching the brain a new pattern. And so, I tell my clients, if you want to perform the dance recital, you got to go to dance class. And so the neurofeedback sessions are exercise sessions for the brain to reinforce this better pattern. And then once you do enough sessions that the brain gets it, then you're good.
Yeah.
And you can move on to a different part of the brain. I mean, I've seen some people get great results with, my starting point is 20 sessions with people, because that just kind of consistently is the number of times you need to show the brain this information for it to really learn it and say, okay.
And that's a quick learner, with 20 sessions.
Yeah, I mean, you can shift someone pretty quickly.
Yeah.
So I like to see people twice a week for 10 weeks as a starting point. For a lot of the adults I see, I see adults for all kinds of things, head injuries, anxiety, depression, and a lot of trauma. People are very affected by emotional trauma, and those kinds of things can really go on to affect your health if they're not resolved.
Yes, we talk about this a lot.
And
Yep.
So I do work with quite a few adults with PTSD from, car accidents, bankruptcy, divorce, childhood stuff, military.
trapped.
I work with veterans who, have PTSD. And the neurofeedback really seems to really calm the nervous system down in a way that other things don't, because it's directly working on the brain.
Yep, and that's what, we talk about this all the time. Your central nervous system, you live your life through your nervous system. Everything you think, say, do, taste, smell, touch has to be processed through that.
Right.
So how it's operating is really going to matter on your quality of life, because input is output. And it was cool when you were saying that you're working on the unconscious mind, because we also say this, there's 300 trillion bits of information that reach your brain every second. You're consciously aware of 50 of those. There's a lot of unconscious signaling. You don't even know what's going on. So there's things that are just trapped in there.
Well, and you also have developed procedural memories, which are excellent at helping you function in life. Like, you know how to drive your car. When you get in your car, you don't think about like, oh, we got to put it in park. Yeah. It's like you're driving, and then you can talk and you can eat and all these things because you know how to drive. So that driving is a procedural memory. Your brain learned that a long time ago, and it just goes on autopilot.
Patterned.
Yeah, but we also go on autopilot with a lot of other bad behaviors that we've learned. Like, we've learned how to have a stress response to something. Like, I always use this example because it's universal to all people, and so moms out there, don't be offended. But everyone think about when your mom yells your name, like she has chores for you to do. Like if I go, Christy!
And a middle name, maybe.
Yeah, right? Or my real name, Catherine! Whenever I think about that, I can literally feel it in my chest. It's like, ugh. And that's a procedural memory too, because you have a body connection to that neural pathway.
Yes.
And so this is why our bodies suffer when we have, issues in our brains, because there's a direct connection between the body and the brain that's not existing in a vacuum up there.
Oh yeah, that's what we say. The physical body and physiology always match.
Yep.
You can always see it. Oh gosh, I love this. Oh, this is so cool.
Yeah.
I know that Katie has a huge heart for this because her husband was the one that she started with on this and helped him out. So with trapped PTSD, trapped emotions.
He's a veteran from Iraq and definitely has suffered with PTSD type symptoms, and neurofeedback really has helped him to, because it does work deep in the limbic system and the nervous system to kind of reassure and calm it down, because people get stuck in sympathetic dominance or parasympathetic, and you really want to be able to switch back and forth appropriately, and so getting the nervous system really balanced helps a lot. So
totally does. This is amazing. That's why this is such a great little marriage that we have.
Yes.
With,
I know, put their head on the right way, and then I'll work on getting their brain patterns back.
Let that brain be able to calm down, because it can change, which is awesome. We love that. I know you had said before, this is it can often be like therapy without the talking, and which is great for kids, because the kids can't sit down and talk to you about their emotions. They're just trapped inside there. They don't know what's going on.
And a lot of kids don't know why they're acting out. Like, when... And whatever reason why, like a lot of people, I don't know why you're that way. I know you talk a lot about birth injuries, and I have seen that in kids' brain maps, and I can see that they have, for instance, like a lot of globally elevated delta waves, which is a pretty good indicator of trauma, kids that have been in the NICU, that's traumatizing.
Very
You know, kids that have had the cord wrapped around their neck and got strangled basically at birth, or were trapped in the, birth canal. I mean, there's a lot of traumatic birth injuries that can happen. And so sometimes you have a kid at birth and they seem like normal from then on. I mean, like their upbringing was normal. You're like, what's wrong with them?
Yep.
A lot of it can go back to something like that, or that they hit their head as they, hit the coffee table or something, and they sustained a head injury. And you don't really think about that when your kids are little, but those things can absolutely affect a person's ability to function well as they go through life, and sometimes it can be years later that kind of injury, a head injury, a birth injury, is really negatively affecting a child.
Yep, we'll often see it in 2s and 3s, and I'm sure that's when they start knocking on your door too.
Yeah, I've really never worked with anyone younger than about 4. Kids have to sit still to do neurofeedback.
Turn on a video.
Relatively so. So, and kids all have, the younger the kids are, they do have higher slow wave. This is why 4-year-olds have imaginary friends, because they're primarily in theta. And theta is the daydream wave. So they're daydreaming all the time. Yeah. So I like to work with kids more like 4 is, kind of on the young side. I can work with them, but I've a little older than that is usually a good time to get a kid in there who's having behavioral problems, can't sit still, having sensory processing issues. Neurofeedback works really well for sensory processing problems.
Cannot process their environment.
Like I worked with one little girl, she's a teenager, who had a pretty severe facial tic, and it made her super self-conscious. She's 14, beautiful, a cheerleader, all these things, and then of course the social stress of her knowing the tic was being noticed would make the tic worse. And she came and did neurofeedback over summer and had about a 70% reduction in her tic.
That is so cool.
Like it went from being totally stressed her out to people barely notice it.
Yes. Oh my gosh. So quality of life is changing over and over. This is great. And Katie's local. I see some people that are watching on here that are far away. So look for neuro practitioners in your area.
Yes.
We also work together in a alternative healthcare group, pediatric networking group that we've formed over the years to have a lot of really good resources for parents that are that their kids are struggling because they're trying to figure out what to do. Yeah. I'm gonna have Katie post her information in the comments. If you guys have questions for Katie, I know she does free consultations, complimentary consultations.
People don't. I mean, I just gave you a lot of information about neurofeedback, but a lot of people don't get it. Yeah. I think sometimes seeing the equipment, having me explain it, I can show you a brain map and kind of how we evaluate. So yeah, I do offer free 30-minute consultations if anybody wants to just come in, talk to me, or you can call me and we do it over the phone. Or if you just want to see what your brain looks like, brain mapping is a good first step. And I try to keep my prices really reasonable. I don't take insurance, so. But it's $95 to come in and get a brain map, see what your brain pattern looks like, and try a session of neurofeedback with that. So
worth it. Okay, that is awesome. I appreciate it. Thank you for coming in and sharing this with us. We have got our next Connected interview series, which is next week, Wednesday. We're going to talk more about trauma with her. She's a licensed marriage and family therapist, so talking about how family stress can affect everyone, which well. And also, if you're hearing about this and especially sensory processing, that you would like to know, is this a sensory issue or is this a behavior? We're doing our sensory versus behavior workshop on May 2nd. That is at the Powder House, and they're gonna have a taco truck there at 6 o'clock. The workshop will start around 6:30, and this is also good for continuing education credits for teachers, so through the Idaho Stars, which is super cool. So we've got 75 seats available, 56 of them are taken already, so I'll put those in the links too so you can get your spot. And thanks for tuning in. You guys have a great Wednesday.
Thanks.
Thank you.